All right, and welcome back to episode 41 of Modern Prescription. My name is Dr. Deepak Dugar.
And I'm Dr. Jeff Toll.
And talking about some cool stuff. We're talking about hangovers, talking about overdoses.
A lot of things you don't want to have.
A lot of things you don't want to have.
One thing you do want to have too, which is really toned abs.
Toned abs, from celebrities and how they get those. And or Drake's abs real?
Are they?
Are they?
I think we'll delve.
We'll delve. We're going to talk about how can you get HIV from going to a med spa?
Go to a really bad one. That's definitely the answer there.
And should you close your toilet before you flush it? Or are you contaminating everything in your bathroom if you don't?
It's an interesting question. Let's find out.
Thanks for tuning in, guys. All right, we are back, episode 41. So today we're talking about a lot of cool stuff.
A lot of stuff here.
Yeah, let's start with how are you feeling this morning?
Well, I had a little bit of a rough morning. So it was my girlfriend's birthday this weekend.
Nice.
And went out last night with her friends, and all these Brazilian people love to celebrate.
Nice.
And may have had, one or two too many. And I don't drink that often, so a little hurting this morning.
A little hungover. So what do you do when you're hungover? What are your things?
It's interesting because, there's a lot of confusion about why we get hungover and what you're supposed to do. I think, what do you think is the number one thing people do to feel better the next day?
I think chug water, I think would be a high one. Okay. I think electrolytes people think about, so like Gatorade and Pedialyte.
Those are good.
I think people try to eat. I think eating, trying to eat something in the morning. Remember in college, you'd wake up in the morning and the first thing you guys would try to do is find food somewhere.
Yeah, find the leftover pizza.
Yeah. Working out, I think, is good to get over a hangover. And the classic
You're not talking about the most degenerate one that like my old college friends used to
have
do.
A beer.
Yeah, the hair of the dog trick. So basically what happens when you're hungover is it's a lot of things kind of going on at once. So number one, you're dehydrated. So alcohol is a diuretic. You're, having a lot of alcohol drinks, but probably not drinking enough water during that time. So you're dehydrated. So that's the first thing. The second thing is when you break down alcohol, you create some things, one of them called acetaldehyde, which when it builds up in the bloodstream starts to make you feel, that's the thing that makes you feel like nauseous and sweaty in the morning. And so what you really need to do is get rid of that and get more water in the system. So that's why, like you said, Gatorade, water, those are definitely helpful.
Right.
Anti-inflammatories, things like Advil are helpful. Tylenol, I don't recommend doing when you're hungover because you've just stressed the liver with all that alcohol. So you want to avoid probably Tylenol the next morning.
And because Tylenol is also processed through the liver.
Yes, and liver toxic if consumed with too much alcohol.
Right.
And then, one trick and one question sometimes patients ask me about is getting an IV when they're really hungover. I mean, this is must be a massive hangover. Mine's not that bad, thankfully, but I do have patients ask me about this. And so in general, the reason the IV is helpful is basically you're getting a full liter of normal saline, which basically fixes the dehydration part and flushes things out. Sometimes for patients, I'll add a little bit of Toradol or Zofran into the IV, which really will do the trick. So that's an anti-nausea medicine, an anti-inflammatory. That really helps.
Right.
There's some places that sell vitamin drips as a hangover cure.
Right.
So the B vitamins, some of these things are thought to help metabolize some of the things that make you feel not well. But I have found for most patients that if you give them just vitamins and not enough saline, it actually makes them more hungover.
Interesting.
So you really need
dehydration being the most important.
Right. So I think that's probably the number one thing that gets people feeling better.
Yeah. I think IV drips are so popular now, right? They're everywhere. Yeah. You go to Miami, LA, New York, anywhere you're partying, Vegas obviously they got huge. The first one was like the company that used to have the bus and they would drive to your hotel room and you would come downstairs. I would say that I think they're brilliant too because of the time factor. Recovering from a hangover can be a whole day thing sometimes. Versus if you get an IV, sometimes you're back feeling normal in a couple of hours.
Yeah.
And just for the time perspective, I think that's hugely beneficial.
Right.
Do you need an IV and do you need Zofran? No. Yeah, absolutely.
But
no. Your body will recover on its own.
Yes, but it makes you feel better much faster, for sure.
Right.
For sure.
And for that time efficiency, I think it's totally worth it. I think while you're having cocktails, if you're having cocktails, I think one thing that I've always found helpful is to drink a glass of water for every drink.
Yeah, that's a good rule.
It's a very simple, basic thing, but no one thinks about it. Because once you're drinking, you're just drinking.
The Brazilians just keep, yelling and putting more drinks in front of you, so you never get another water.
What are you drinking last night? What kind of drinks?
I normally drink either wine or whiskey as my hard alcohol of choice usually. But they were making like Brazilian drinks and all sorts of stuff. So I was mixing things, which I don't know. Actually, I think that's a funny
good question.
thing. Yeah. Does mixing different alcohols make it worse?
What do you think?
I don't think that's necessarily true. I know everyone says that. I know sugary drinks, and that's another one, can make you more hungover. Also, probably because it's making you more dehydrated a little bit.
But from a scientific perspective, because technically they're all ethanol. They're all alcohol molecules that are being broken down by alcohol dehydrogenase.
Right.
So should mixing them technically give you a worse hangover?
I don't think so.
Yeah, I think
it's like if you have one of those nights where you're like mixing, it just implies you've had a lot of drinks.
Right. Because if you have a little bit of wine and a little sip of tequila and a little sip of beer, you're probably not going to be hungover the next day, right? So it's not the mixing.
Right. It's the fact that just to have mixed 4 different things
means
implies you already had at least 4 drinks just to start.
Right.
And you probably had more than one of each.
Right. That's a good debunked myth. And then I guess the other one that people always ask is, do certain things make you more hungover than other things?
Like light versus dark alcohols.
Yeah, or drinking wine. Like, some people say, hey, when I drink wine, beer. Liquor before beer, never been sicker. Is that what it is?
No, it's liquor before beer. You're in the clear.
In the clear, yeah. Beer before liquor, never been sicker.
Yes, exactly.
Yeah, because you're supposed to tone your night down.
Right.
But
again, it's just because of how many you're having, not what it is.
I completely agree with you. I think that's completely correct. And it's also a concentration of alcohol. So remember, some wines are 13%, some are 14, 15%, some beers are 20%.
Right.
Hard liquors, obviously, in the 30, 40%, depending on what you're drinking.
But supposedly for alcohol content, one drink, if it's actually poured as a drink, and most bars, they pour you more, but one shot is one beer, is one glass of wine, about the same, I think.
About the same. Yeah, conceptually, yes. Yeah, that's a really interesting point. I also think that another hack is drinking earlier in the day. Like not drinking right before you go to bed. So give your body time to get rid of it.
Yeah, and you probably drink water before you go to bed. And
process it all.
Eat dinner maybe after.
Yeah, just try to process it versus the nights where you're drinking till 2 a.m. and then you're in bed at 2:15 and your last drink was at 2.
Right.
That's a guarantee almost hangover.
Yeah.
Because you're still processing it as you're sleeping.
That's right.
Yeah, interesting. And then right now in America, we're also having a huge issue with overdosing. Yeah. That's been an issue. It's getting worse every single year, unfortunately. What do you think are some of the biggest things that are causing it?
So, alcohol, you can overdose sort of, but not, it's very difficult. And usually, someone can have more likely for dying from alcohol is to have terrible withdrawal, which can actually be life-threatening and dangerous. You can develop delirium tremens where you have seizures and all sorts of things from drinking a lot of alcohol and then stopping. That's actually usually more dangerous than just the drinking part.
Or the behavior on alcohol, drinking and driving,
and doing bad
things like that. Yeah.
But there's been a spike in deaths from drugs that were laced with something called fentanyl, which is a really strong pain medicine, and I think is more addictive than regular street heroin, I guess it is, that people are doing. So it keeps people coming back for more. Yeah. And been a lot of, I think this, I was reading, it was like 70 or 75,000 deaths in 2020 from overdoses.
Yeah. Right. Which is sad. I mean, that's all preventable technically. Suicide aside, just regular plain overdoses that are unintentional. Right. That's really a depressing, sad thing. And I think a lot of it comes also from not getting your product of choice from a reputable source. So I think marijuana is a good example now that's legal in a lot of states. Yeah. Getting marijuana from a reputable source. In the UK right now, there was a study, they were talking about how a bunch of kids got sick and poisoned basically from buying edibles, like the marijuana gummy bears, online through some random website that kid popularized at a school. And it was not from a reputable source. And a lot of the kids ended up in the hospital because it was probably laced with something, of course, that makes it a better high and also cheaper to make.
Right. And that's the argument. I mean, there is a very real and very good argument that some of these drugs should just be like regulated and legalized
for the regulation purpose, safety-wise.
Right.
Yeah.
So, I mean, obviously, it's a fine line. You don't want people doing these things that are super addictive and really bad for you. But if they're going to do it anyway, you would rather they're going into like a medical type of clinic to do it than on the street.
Right. And that's obviously the big argument in question for a healthcare provider like us to think about. Does regulating it and making it legalized give a persuasion that it's okay to do it? Would more people be more likely to try negative substances?
I think there's some countries, I think Portugal, there's some countries that have experimented with this, of like more open legalization of these other things. And I think it actually did decrease the deaths. I just don't know what it's done to like how many people are using.
Right. Like I wonder in Amsterdam, are their user rates higher just because it's legalized versus what it is in the States? And I doubt it.
I don't think so. I mean, people probably tourism-wise go there to do stuff.
Right. But the actual citizens.
Probably not.
Yeah, probably not. And I feel like in California, I don't feel like in the past 3 years it's been legal. I don't feel like there's been massive abuse where I feel like everyone's high at work all of a sudden.
Well, they already were.
Depending where they work.
Maybe not your employees.
Not my employees.
But a lot of people are.
Yeah, that's probably true. The
line was very slow at the DMV.
Yeah, I think it's really interesting. And I think that the question will be in the future. So right now, the big wave that everyone's talking about is psilocybins and like psychedelic drugs that are potentially able to unlock areas of our brain that we don't use potentially, or help us trigger emotional traumas and kind of deal with them, things that are kind of hidden. So a lot of people are into this, like ayahuasca and these kind of drugs. Will that be the next wave, right? That's the big question that people are asking now.
I think so. Personally, I think that I agree that these drugs there are potential harms, if people have underlying psychiatric stuff and you take, ayahuasca or psilocybin, it could make things worse. You could have a psychotic break, things like that. But there definitely is there's real data studied where with like some microdosing or low dosing paired with like therapy, it really can help people unlock trauma from childhood and kind of have breakthroughs.
For depression. Yeah, so there's a couple of clinics that are toying with this right now. And obviously it's very popular in Silicon Valley, psilocybins and, all kinds of psychedelics. Yeah. But for depression, low dose therapy, another thing that's commonly used, and there's clinics for this, is ketamine. Yeah. Ketamine at a very low dose. Ketamine is a typical drug used as an anesthetic agent that's used for anesthesia, but it also became popularized as a street drug. It's kind of like an advanced level of cocaine where people do what's called ketamine. Again, not restricted, like not safe at all, should not be done on the street level, but using low dose of ketamine through an IV infusion monitored for depression therapy. And they've been trying and using this, and the studies have showed that this does significantly reduce your levels of depression and create long-term benefits potentially. It's not something that you have to be hooked on for the rest of your life.
Right.
And that being studied is giving more hope to the psilocybin community for potentially doing the same kind of things with psychotherapies.
Yeah, I think, and ketamine also is being used for chronic pain also, getting people who have been addicted to like oxycodone, let's say, to actually get off or wean off.
So. And oxycodone being a medication you take multiple times a day versus ketamine, just to explain, is once a week. Or maybe once every 3-week infusion.
I mean, the crazy thing is just that all of those pain medications were so rampantly being used. And like we got to this place where doctors feel totally comfortable writing a prescription for oxycodone, which is basically heroin in a pill.
I know.
And that's, we do it dozens of times per day, but you have to have this huge conversation about, can someone decide to take a psychedelic by themselves?
Exactly. But you're allowed to take a opioid that could probably kill you if you took 3 or 4 at a time, can definitely kill you with respiratory depression. Yeah. And yet that's totally legal. That's totally fine.
Yeah.
But something that unlocks the power of your brain to think on a higher level and maybe... there's different arguments. There's 2 podcasts I just listened to recently on this. One was the Logan Paul's podcast, and he had Mike Tyson on it.
Got it.
Okay, Mike Tyson was on it, and Mike Tyson's a huge believer in psychedelics and weed, and he believes that marijuana and psychedelics and specifically mushrooms is the reason he is now back. He's back to fighting. He lost 80 pounds and he's in great shape and he feels like he's on a spiritual journey and he completely contributes it to his scheduled and particularly planned use of these drugs. So he doesn't do it willy-nilly. He plans it out and he thinks it gives him a lot of openness to his mind. On the Logan Paul's podcast also, he had an episode with Sadhguru. Sadhguru is a very famous Indian Hindu leader, spiritual leader who is very, very well respected around the world, has millions and millions of fans and adorers. He is the complete opposite. He feels like psilocybins and drugs and marijuana, everything is completely just contaminating our body's natural thought processes. That we as humans have all these abilities to deal with these emotions, yet we choose these lazier paths. It's like what he was describing as taking the stairs versus the escalator. And so it's like we just want the escalator. Because, it's like drinking. It's like if you were trying to bond with a friend, if you have you and a friend, you sit yourself in a room and it's 4 hours versus you and a friend, you sit yourself in a room with a bottle of tequila for 4 hours. Yeah. You're going to bond much quicker with the tequila bottle.
Yeah, definitely.
And so that was Sadh's guru point is that are we taking the escalator in life by using drugs?
But it's interesting because very, very many human societies around the world had their version of this sort of spiritual, something that was sort of a psychedelic. So there's, in the South America, ayahuasca, and some native North America, there's like peyote. In Africa, there's some like toads that can create some.
Mike Tyson talked about the toads. He went to Africa to eat the toads. Yeah.
So, and then a lot of those cultures, they use them, in either religious or some other ceremony to make people feel.
Unlock that.
Yes, exactly.
Yeah. I think it's a great conversation because I do think that we are heading that way regardless. So I think everyone, even if you're anti-drug, you have to understand it now. You can't just keep ignoring it. Like, prohibition in the day, there's people who are against alcohol. And now obviously, there's still people who are against alcohol and don't drink, but you have to at least understand the concepts of it, understand the business of it. And I do think that as physicians and people who are interested in healthcare, we will have questions about this stuff and people will want to know, hey, well, could I try psilocybins? Could I try, ketamine? And not knowing that these options exist, I think is harmful to our patients. Yeah, and speaking of harmful to our patients, the other thing I saw recently was an HIV, 2 patients getting HIV from a med spa.
That was crazy. Yeah, you sent me that article. Wow.
Yeah.
And it was, so who was doing that? How did this happen?
It was supposedly a doctor, and this person's going to jail for not being a doctor. Yeah. She was fraudulent on being a doctor, fraudulent on being able to perform these procedures, tax fraud, and
the crazy thing is, I read the article and basically the person, it was not only that they were not really a doctor performing medical treatments and accidentally gave a couple of people HIV, but then the actual money they made from it, they also were tax fraud. I know. Like it was every single, at least make the money and put it in the bank. But no.
A totally shady person. What it sounds like is from PRP Facials, which is where they draw the blood out of your arm, spin the blood, take out the platelet-rich plasma of it, which is the PRP has the growth factors. And then we use this to either inject in the hair to make the hair grow, or we use it on the face as a topical device product to actually make microneedle punctures and deliver these growth factors into the face. So it's a very popular treatment. Kim Kardashian made it kind of widely known. I think in like 2007, 8, whenever she did an episode of her Keeping Up with the Kardashians, in Miami with the doctor who did the PRP facial on her, and it went viral. That was a real doctor. Yeah. He's a very, very, very reputable, famous doctor. And so since then, it's become very popular. Does PRP facials work in general? Yes, they definitely work. They help. It's the microneedling that really makes the big difference. It evens out skin tone, can reduce scarring. But what happens is that these devices are expensive, okay? And so a PRP device, like the pen, can be up to $10,000 to $20,000, depending on how great the pen is. It comes with a tip. The tip have little needle punctures. And so you're never, ever, ever, ever supposed to reuse the tip.
No, obviously.
Obviously. You punctured a human with it, you throw it away. It goes in the sharps. But
when you're not a doctor.
When you're not a doctor and you're not following medical regulation, you can reuse the tips. And what they did is they reused the tips on hundreds of patients. And one of these patients had HIV, and now it was in the tip of it, and now it got put into another patient.
Crazy.
And so 2 patients contracted HIV from this person. And that's a lifelong
I would probably
sentence.
be pretty mad.
I would be very mad. That's a lifelong sentence. Can you imagine?
Yeah, I mean,
HIV?
thank God nowadays, HIV treatments have come along such a long way that
of course.
If you take your one pill a day, basically a combination pill, it actually, there is no difference to your expected life expectancy.
Yeah.
So it's incredible where they've come from 20 years ago, but obviously.
Yeah, and should you have gotten HIV from a promiscuous activity that you self-inflicted on yourself, it's still unfortunate, but versus if you go to a med spa, you pay good money to get a facial and get HIV, that's ridiculous. Yeah. But that's something that's a real thing, and I think there's a whole culture of trying to find cheaper alternatives for everything, in America. I guess across the world. And I even have this. I have a patient right now who just messaged me. She's a beautiful Instagram model, has about 4 million followers, very well known. And she had a nose job and she went to Turkey to get her nose job. Turkey's really famous for doing aggressive nose jobs. More importantly, they're cheap. It's like super cheap, like 1/4 of the price in America. And now she has a huge problem with her nose. And it's not because she went to Turkey. I'm not poo-pooing Turkey doctors. There's a lot of phenomenal ones. But she has a problem and she doesn't want to go all the way back to Turkey. So now she wants to get it fixed here. So it just becomes a complicated process because if she goes back to Turkey with the original doctor, he might be able to fix it, reasonably. Versus here, it's going to be very expensive for her to fix. And she's now going to be spending more money than she did by taking the cheaper route initially. And that's the reason people end up in these weird predicaments. Like, when you're getting a procedure, if you're going to a reputable clinic or not. You can just tell. You look them up online. You see where they went to school. Like anyone going to your office can tell. They're at a beautiful building, have a beautiful view. They see your credentials. You went to Jefferson. You went to residency at Cedars. Versus when you go to the med spa and the mini mall and you don't know anything about the person. You just heard that it's $200 and your girlfriend went there.
Be careful.
Be careful. Yeah, be careful. You're literally gambling with your life sometimes.
So let's say you were a celebrity and you were hoping to get your abs ready for summer. Where would be a good place to go for that?
So you're referring to Drake and the video that went viral of him. So he posted a video of him in the gym with his shirt off, and it sparks rumors again about whether or not he had liposuction.
Yeah, he had abs.
He had abs, really defined abs.
Very defined abs.
Very defined abs. I will say that generally speaking, a telltale sign if you've had liposuction is when your ab definition is much more than the rest of your muscular definition. So sometimes, if you have puffy arms and puffy chest and, puffy face, and yet you have super ripped abs, it could be a telltale sign that you've had some sort of help. Some people do have different body builds, so I'm not going to say anything negative because Drake is the GOAT. But I'm not going to say anything negative because Drake also has...
He's in pretty good shape. How old is Drake?
Drake's got to be our age, late 30s. I don't even think 40 yet. I think late 30s. But Drake, has the work ethic to go to the gym every day and put out the music he does.
I mean, even the not abs part, he looks like he goes to works out.
Definitely works out. And then B, he also has the money to get plastic surgery if you wanted.
He could definitely afford plastic surgery.
And he could definitely afford to pay full price.
He could have a plastic surgeon just
come to his house.
Or just work for him full time.
Yeah, totally.
And you wouldn't even notice.
Totally. So I would say, I'm not going to speculate on whether Drake had plastic surgery. No, I'm just going to say he looks great. And whatever he's doing, he should keep doing. And none of us need to give him advice.
I think he has it all figured out.
Yeah, I think so too. But I do think there's a huge conversation about celebrities admitting and not admitting.
I didn't really know that was a thing. Men getting
liposuction
defining surgery, but now we had Dr. Rahal on the show and he talked about it a little bit. And I know some other doctors here that do that.
I have a friend who had really bad liposuction on his abs, and it looks so obvious because he has he wasn't like a fit guy. He was kind of fit, but a little chubby. And so his face is still chubby, his arms are still chubby, his chest is still chubby, but all of a sudden now he has abs. And it looks very odd. But I don't think he realizes it looks odd, so he takes a lot of photos and posts them a lot.
Got it.
And
he's got to show off that spend.
Yeah, he spent a lot of money on it. But it's just funny because in life, sometimes you don't realize what your behavior pattern is, being weird or not. And so it's so important to have close people around you who can you can balance.
So you purposely don't tell him, right? So he keeps posting.
I'm not close enough with him that I'm going to call him out.
Got it.
But it is awkward because all of us can tell that it just doesn't look right. It doesn't look right. Going to the gym is the best thing though, no question.
Yes, and so so what's the best natural way to get abs? So that's a question that a lot of. So one thing I will say is it's not just doing a lot of sit-ups. If you have belly flab, you can, no matter how many, you can have a 6-pack under your fat and you can't see it.
Right. Good point. Yeah.
It's really the losing the weight.
Yeah, losing the weight.
The weight will get you at weight with minimal sit-ups. You can get potentially abs.
Right. Just
but
by losing weight.
A lot of sit-ups with not losing weight, you won't get the abs.
I think that's beautifully said, because you're right. A lot of people think that I got to do crunches. It's just like doing, bicep curls or doing chest. Like if you're chubby, the fat's over the muscles. Right. It's not going to be as defined as you want.
Right.
So definition is key by losing weight.
Yeah, because I think a lot of people who are, let's say, maybe 30 pounds overweight and they want to lose weight.
Right.
They're doing crunches. Instead of doing like cardio and dieting.
Treadmill,
the crunches are not going to make you lose weight at all.
Right.
They're really not.
Yeah, you're just building a little bit of muscle.
You're building muscle.
Yeah, that's a really good point. And then the other thing that we were going to talk about today was also about, you want to bring it up?
What were we talking about? About making your toothbrush?
The toilet.
This is like the weirdest thing.
I know.
So I've never thought about this before, but I liked it, so I wanted to talk about it.
So the question is, so the article read, the title was, is taking your morning coffee into the bathroom making you sick? That was the whole premise.
And so, obviously both of us read about health things in the news, but even before we did the show, but obviously we're looking, seeing what's going on in health. And so we get stuck, we clickbait too.
Of course.
That got us.
That got us. And so the whole premise is that when you're using the restroom in the morning, when you're having a bowel movement, when you flush the toilet, studies have shown, and they've done this with actually like particle tracing, that you have about 12 minutes of aerosolization of particulate matter from the toilet that gets in the room, okay? And they found that the most common things they're on are the shower handles, the faucet knobs, the toilet handle, of course, all the porcelain.
Right.
But the most common thing that also gets on is your toothbrush or your toothbrush holder. So a couple of comments is, one, you should always put a cap on your toothbrush or put your toothbrush away. Don't have it sitting out. And then number two, the most scientifically proven thing to reduce the aerosolization of fecal matter in your bathroom is to close the toilet before you flush. And that is scientifically proven to make a huge difference.
So what are you saying to all the people listening who both keep their toothbrush out and have not been closing the lid this whole time?
You have been contaminating your entire bathroom with fecal matter, and to a small degree of small aerosolization, and you might have some poop on your toothbrush at times. Aerosolized poop. So it's not like the same thing as particulate, but it's microcontaminations.
Right.
That being said, we have microcontaminations every day.
Bacteria's everywhere.
Everywhere. But I would say closing your toilet, super helpful.
I think it can't hurt to close the toilet, but I will say there's bacteria everywhere. We don't like to think about it, but it really is the case. We all open door handles and do all the things we do.
I know.
Our body has an immune system. We're meant to.
100% agree. 100% agree.
And the GI tract, especially, the first thing when stuff gets in your mouth, we have enzymes that break apart, both food and bacteria. And then the next place it goes is right into the acid. So everything goes into the stomach acid and for the most part gets killed.
Yes.
If you get a huge amount of a bad bacteria in there, like Salmonella, E. coli, obviously you're going to feel sick.
Right.
Your body wants to purge it. So you vomit, diarrhea, it's trying to get it out of there. But
like food, you're talking about food poisoning in general.
Yeah, like food poisoning. But if it's a little bit of bacteria because someone didn't wash their hands or whatever, probably gonna kill it in your stomach.
Right.
No,
but I totally agree.
But for the germaphobes out there,
close your toilet before you flush.
Close it.
Very helpful. And back to food poisoning with IVs, to take it full circle.
Yeah,
I think that's one of the most beneficial things you can do if you ever get food poisoning.
It really helps tremendously. So I agree. There are other uses for IVs that are not just hangovers. And one of the best ones is gastroenteritis. So again, gastroenteritis is either a virus or a bacteria that's causing your body to basically want to get rid of this thing. So you're vomiting, you're having diarrhea. And again, you get super dehydrated and you lose electrolytes. So the number one thing that's going to make you feel better is to replace the fluids and electrolytes, which is why like a liter of lactated ringers, and you can add some, again, Zofran or Pepsid or something to kind of make you feel better, and it can do wonders. If you're having one of those I'm sure we've all had these where you feel like the sweats and hot and whatever. If you give someone, a PPI,
which is a proton pump inhibitor,
so you block
like Pepsid,
you block their stomach acid. You
Nexium,
yeah. So if you give someone Nexium or Protonics and you give them some Toradol or some anti-inflammatory and Zofran in an IV, that person will feel significantly better within like 30 minutes.
Yeah, agreed.
Yeah.
But again, consult with your doctor. Yeah. We're not giving any medical advice. Disclaimer. Awesome. Well, thank you guys for listening. Great episode. Stay tuned. We're going to have a lot more guests coming up. We're going to have a lot more amazing content and dive deeper into the topics that you guys are asking about. So continue to ask questions.
And I'll try to be less hungover next time.
Yeah. Well, you have your cure ready to go.
Yeah.
Do you ever put an IV in yourself?
I've never put an IV in myself, no, but I've had my nurse do it before.
Yeah. I've had my wife put an IV in me before.
Really?
Yeah, because she's an anesthesiologist, so she'll bring the supplies home, and one time, it was for gastroenteritis. It was for food poisoning.
Anesthesiologists are the best at putting in IVs of anyone. They should be, right?
The best.
They get the reps.
I think they're the best, and then nurses who do it on a regular basis are probably the best in the world, because they sometimes put in like 10,000 IVs over their career.
Yeah, so it's funny because in the LA kind of concierge medicine world of, having, when you're sick, you have a nurse come over and do these types of things. There are like 2 or 3 people who are known to be the best IV nurses like in the world. So,
nice.
So some of these people have their own clients, so to speak, but are, all the concierge doctors kind of mutually agree that these are people we really, really trust, that have worked on a lot of our patients and just are amazing with IVs.
Yeah.
Because some people are scared. People pass out.
Oh, totally. Yeah. And before surgery, if that's why I pride myself on having really good nurses and anesthesiologists who usually get on a one stick. Because if you have to stick them multiple times, it's so painful.
It sucks.
It's a terrible experience to go through. Even that one poke sucks. So if you can get it over in 1 second, it's awesome.
Yeah. And don't put them right in the antecubital.
Yeah, if you're going to have it there for a while. Yeah, I totally agree.
They always put it in the worst spot, So what I'm talking about is right in kind of the crook of the elbow on the other side where you can't sometimes people put an IV in there and you can't bend your arm.
Yeah.
Because the vein looks big.
Yes.
But it's not a comfortable spot.
It's a great spot to draw blood.
Yes,
because that's going to be just like a momentary thing for like 2 minutes.
Totally agree.
Yeah, but if you're going to hang out with an IV for a few hours, that's
not comfortable.
Not fun.
Yeah.
All
right. Keep listening.
Yeah, thanks. Continue to share, subscribe, and like, and close your toilet when you flush.
I'll do that.
Thanks, guys.